Well, health officials are warning that this year's flu season could be severe. They're pointing to Australia, which is seeing its worst flu season in 5 years. Experts say that's a key indicator of what we could see in the United States. Public health officials are worried people would have a false sense of security after COVID precautions created 2 years of milder flu seasons. And this has the CDC urging everyone 6 months and older to get their flu shot. So here to talk about the government's response to these viruses is Health and Human Services Secretary Xavier Becerra. Mr. Secretary, great to see you again.
Thanks for having me, Vlad.
So let's talk about what the administration is doing to ensure healthcare facilities aren't overwhelmed with flu cases, especially as potential winter COVID surges loom.
Well, we just need to do what my mom always counseled my sisters and me to do, and that is to prevent versus remediate. So that means get vaccinated, be very careful who you're around, and let's be cautious because the flu hits hard. It does kill at times, and what we don't need is to get sick in ways that affect the rest of the family.
So in the meantime, we are still dealing with COVID. There has been talk about, a bit of a surge or an uptick during this time of year. We know that the Biden administration has asked Congress for additional funding. Where would that funding be used? How would it be used in order to combat any potential COVID surge?
Anne-Marie, we prepared for this fall-winter surge, not just flu, but also for COVID. And so we've got the vaccines out there, and thanks to the close to 8 million Americans who've gotten their updated vaccine, we have more than 40 million out there for folks. So please get vaccinated. It's the best way to prevent not only COVID, but also, as we said, the flu. What we're doing is trying to get ready for what might come next. And, one of these days, another variant may pop up that doesn't where our vaccines don't work as well. We have to be ready. Without the resources to continue that planning, Anne-Marie, it's very difficult to say that we'll be ready to take on anything COVID brings the American people.
Yeah. So, Mr. Secretary, the numbers that you just cited there are relatively small compared to the initial numbers of people who were vaccinated when the vaccines first became available to Americans. You know as well as I do that many Americans are fatigued. They've received not only their first shot, their second shot, some cases they've received the booster, and with the rise of variants, health officials are asking Americans to get boosted again. What do you say to people who say enough is enough? I know people who've gotten the coronavirus and they're vaccinated and they're boosted and they have a little bit of a sore throat and a cold, but they come through it. In any case, they're not being hospitalized, so I don't think I need this next booster.
So, Vlad, the first thing I'd say is we still have some 300-plus Americans dying a day from COVID. That's not acceptable. And while in the time the president has been in office, we've seen the number of deaths drop by 90%. Again, it's still unacceptable to have more than 300 Americans dying every day. Second thing I would say is this. How many flu shots have you taken over your lifetime? I just recently, about less than a month ago, got both my flu and COVID update. One day, one time, together, and I'm going to do everything I can to stay protected. But how many times have I gotten a flu shot? Over the course of years, many, many times. Well, what we're saying to you is understand that COVID's around, and what we want to do is protect ourselves because people still are dying. Folks who are dying are usually a little older or have some complications or have a compromised immunity. But for the most part, we can stay safe, not just by saying we're strong and healthy, but by getting that vaccination.
It's a good point, Mr. Secretary. I mean, I've gotten my flu shot every year of I think, going back to when I was in college. And it's just you go to the pharmacy, get a flu shot, and you just get it done.
Yeah.
So it's hard to understand why people are struggling with this.
This is a mental shift. This COVID took us by storm, sort of, and what I think people have been. It's been challenging for people to continue to shift how they feel about COVID. Now you approach COVID like you would the flu. 2 years ago, we weren't treating it like that. And I don't know, people are kind of slow to change. But I want to ask you about another virus that we've been talking about a lot, monkeypox. We haven't talked a lot lately about monkeypox, though. But where are we in terms of tackling this vaccine? For a while there, the idea of tackling sort of the virus, the idea of cutting the vaccine so that there could be more made available was something that was being discussed. Do we have enough of the vaccine to combat whatever may come with monkeypox?
Anne-Marie, and thank you for asking that question, but monkeypox is still with us, and we have to be very careful. Again, these viruses do not discriminate. Whether you're rich or poor, live in the south, north, east, west, those viruses can hit you. So please take precautions. The best precaution is the vaccine. So on monkeypox, we know it's hitting populations based on very close contact. So if you think you've been around someone who may have had or has monkeypox, you want to make sure you go in and get tested and probably get vaccinated. What we're finding is that we've been able to keep ahead of monkeypox. We have enough vaccine out there. It's safe and effective, and we have sufficient supplies. And what people are getting in terms of the vaccine works. And so whatever the stories or misinformation is out there, the monkeypox vaccine has helped a lot of Americans. And please, just like with the flu, just like with COVID, if there's a good vaccine that's safe and effective, get vaccinated.
Before we let you go, Mr. Secretary, as you know, we are in the middle of National Hispanic Heritage Month. Tell us about this Latino health tour that you've initiated, what it is accomplishing, how your department plans to keep health services available in these communities, and why you felt it was important to launch a campaign like this.
Vlad, what makes this tour special is that we're doing what we did, for example, with COVID and vaccination, what we did with getting people insured under the Affordable Care Act, Obamacare's health insurance marketplace plans. We're reaching people where they are. And too often their communities, usually lower income communities, many of our black and brown communities, don't often get touched right away, and they either die of COVID or they don't get the health insurance they need for their kids. We're going to reach out to folks, and this tour that I'm doing is to reach out to the Latino community, which often is the last to get vaccinated, the last to have health insurance. We don't want that to be the case. We want every American to get the benefit. We want them to see that resources are there, and if we let them know, we think they'll come. And so we're going to go where they are, and hopefully that means they'll get vaccinated, they'll get the insurance they need, and at the end of the day, everyone will be much healthier.
All right, Secretary Becerra, thank you so much.
Thank you.